cranial nerve assessment, starting with optic, cranial nerve 2, the optic nerve. Visual acuity, and then also visual fields per confrontation. I'll close one eye. All right, I have you read from the smallest line you can.
NPH.
Good. Switch eyes.
NPH.
Good. So patient is 20/20 vision, which is a normal finding. Now I'm going to test your peripheral vision, okay? So cover right eye. All right. And tell me, and look straight into my nose. Tell me when you can see my
I can
fingers.
see it. I can see it.
All right, switch eyes.
I can see it.
Good.
I can see it.
Good. So there is full symmetric visual fields present, which is a normal finding. Cranial nerve 2 and 3, the optic and ocular model. I'm going to be doing my pupil inspection. So pupil is round, equal, and reacts to light, which is a normal finding. I'm going to do my direct and consensual light reaction. So eyes do react to both direct and consensual light, which is normal reaction. Looks behind me. I'm going to have my finger come close to you. So eyes converge, and then also the pupil constrict to near object. Cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens. I'm going to do my extraocular movement, so you're going to follow my finger with your eye, okay? Just your eye. Good. There's no nystagmus present. Eyes move smoothly on each direction. Okay, I'm gonna have you look straight to my eyes. I can bring it forward. Okay. So the eyes converge again, and then our pupils constrict, normal finding. I'm observing the eyelids for drooping. The eyelids are equal and symmetric. There's no drooping, which is a normal finding. Cranial nerve 5, the trigeminal. I'm going to go ahead and do a motor and sensory test. Can you clench your teeth? Can you open? Resist me? Good. So strength on both sides is equal. All right. And then also I'm going to test, can you close your eyes? And tell me if it's sharp or dull, okay?
Sharp. Dull. Dull. Sharp. Dull. Dull.
Good. So patient is able to identify both dull and sharp sensations. Cranial nerve 7. So facial, I'm going to have you raise your eyebrow. Good. You're going to frown. See your teeth, you smile, and puff your cheek. Good. So facial movements are symmetric, no lags found, which is a normal finding. Cranial nerve 8, the vestibulocochlear. I'm gonna whisper and you repeat.
222. 222.
Good. So the gross hearing acuity is intact. Cranial nerve 9 and 10, which is glossopharyngeal and vagus. I'm gonna have you open your mouth. Say ah. Good. So the uvular and the soft palate rises midline, and there's no deviation, which is normal finding. The speech is clear. There's no hoarseness, which is also a normal finding. Cranial nerve 11, spinal accessory. I'm observing the trapezium for any atrophy. There is none. I'm going to have you shrug against resistance. Good. So shoulder strength is 5 out of 5 bilaterally. I'm going to have you turn that way, resist me. Good. Turn this way, resist me. Good. Muscle strength is bilateral and asymmetric. Cranial nerve 12, the hypoglossal. Have you open your mouth. You stick your tongue out. All right, and then can you move laterally? Good. So there's no atrophy found. There are also tongue is midline and lateral movement is symmetrical.